Hi, everyone. My name is Debbie Gittens, and I would like to present to you my practice experience synopsis of my EBI project, Work Smarter, Not Harder, Time Management for Nurses. As a case manager, when we were tasked with identifying a problem in the workplace, as a case manager, I realized that time management is a challenging skill that many find hard to accomplish. Although it's not exclusive to nurses, time management can be a very valuable resource when it comes to getting tasks accomplished. As nurses, we work at times in very chaotic environments, juggling many different tasks and interacting and trying to meet the needs of a number of families, patients, and coworkers. During my scientific research, in a 2012 national survey of 3,000 nurses, 80% reported that at least one aspect of care was not done during a shift due to a lack of time. This can lead to poor patient outcomes, and due to the demanding nature of the nursing profession, time management is an important skill that can help nurses accomplish the many tasks and decisions at hand. So, for my project, I decided to do this EBI intervention, which involved um, providing an educational session geared towards evaluating time management skills that will result in an increased awareness of how nurses can optimize their time using proper planning, goal setting, and prioritizing their goals and activities. My intervention involved providing an educational PowerPoint presentation targeting 15 nurses which worked in my department, and they participated in. I first presented the presentation to them and gave them helpful tips and skills and principles to help accomplish their different tasks related to time management. The two main principles that I outlined and focused on in my presentation was the pickle jar theory and Pareto's 80-20 rule. Post presentation, there was a follow up time management survey which attempted to extract the data, looking to decipher whether the information provided was relevant and was considered useful towards improving their individual productivity and job satisfaction. As part of the evaluating our MSN essentials for this course, the first one I would like to identify at this point is essentials number 4, which is translating and integrating scholarship into practice, which involves recognizing that master's prepared nurses apply research outcomes within the practice setting, resolves practice problems, and works as a change agent and disseminate results. The MSN Essential was met, I believe, through various steps of this EBI project. Going through the process of identifying a problem, which was started with developing the PICO question, investigating and researching the issue to substantiate the best evidence to support the question. I was looking to outline the importance of the time management for nurses and their practice. And based on the information obtained from the research findings, I implemented an educational project which would help fellow nurses in their practice, leading to improved job satisfaction and productivity. As a change agent, my hopes are that the knowledge provided would help the nurses develop another essential skill that will be helpful in their daily work environment. Also, as part of the results of my EBI project, I realized that the educational session was able to increase the knowledge base of the nursing staff on time management skills and demonstrated positive responses to the education. Primarily, the nurses expressed that they did not have an active plan. The majority of the nurses, identified that they did not have an active plan in place on a daily basis prior to them actually viewing my educational PowerPoint presentation. And they realized that they weren't as organized in their daily work. And it was not help the way that they were doing their work was not necessarily beneficial to them in getting their work done on a daily basis. So that was a very positive result I found, because at least they were able, besides me getting the information from them, a lot of them were able to actually acknowledge what their work habits were and where they found deficits in their work habits. A lot of them, like I said, realized that they weren't organized, they weren't prioritizing their tasks in order of importance, um, compared to how like I said, since I focused on the pickle jar theory, they reference back to me presenting the pickle jar theory to them, and they compared their work habits, their current work habits to the pick a jar theory, and they realized that, they weren't prioritizing their work in that manner. So they did identify that that was an important tool that they learned that they will try to implement going forward in their daily work habits. Um, and also, and they also were able to give good insight into responses to their stress level, because they realized in terms of looking at job satisfaction, um, they realized sometimes that they would get stressed out because they weren't able to get, like, they were always looking to get things done as a case manager. When you know you have 20 patients on your work list that you have to prioritize, who's going home today, who's going home tomorrow, who needs reviews done. They were realized that sometimes they were stressed because of that factor. So that also, brought out that aspect of it, that they realized, okay, yes, because of poor time management, they also increased their stress levels. So in controlling the stress, time management had to play, developing good time management had to play an important part in that. Okay, so that was another result of doing this project. And then in identifying another MSN essential, which is number 7, interprofessional collaboration for improved patient and population health outcomes. Um, I realized that I met this as a result of finding the best way to plan, coordinate, and implement my EBI project. And in saying that, I would say that when we had to then start to develop our EBI project, we had to come up with, okay, how are we going to first present it to our coworkers and present it to our bosses so that we can get the approval to even implement it. So that was one way that I found that, I met this essential, MSN essential. And the other part of it is being able to work collaboratively with others. Um, can be very difficult because everyone has their own ideas, has their own way of doing things. So actually getting everybody on the same page or the same wavelength, and getting everybody to collaborate effectively and work together is also very important when it comes to being able to disseminate and put information out there to people so that they will be able to accept it or at least work along with you to get things done. Um, I also said that it's very important to be receptive to other people's ideas and have a willingness to compromise in order to get things done. So with this essential, I think it was met, like I said, in doing this project. The other essential I would like to discuss is essential number 8, which is the clinical prevention and population health for improved health. This recognizes that the Master's Prepared Nurse applies and integrates broad, organizational, client centered, and culturally appropriate concepts in the planning, delivery, management, and evaluation of evidence-based clinical prevention. Okay, so with this essential, I believe it was met as I was able to use data and scholarly evidence to develop a plan which provided knowledge to improve nursing practice. Ultimately, the goal is to improve efficiency and effectiveness in the work setting, which could lead to improved patient outcomes um, throughout a population. So it will hopefully affect patients, their families, and also, coworkers, everybody. So, like I said, also going back to my project and its implications, I believe that improving time management skills can lead to a much more organized and healthy work environment. Quality of patient care and patient satisfaction can also be improved due to improved time management skills. Because once your time management skills are improved, you're better able to provide that effective and efficient um, patient care experience. Thank you.